Welcome to our presentation on the LGBTQ plus youth in school supportive interventions. Today we'll be talking about how we can support queer youth populations in schools through individual and school-wide intervention. My name is Sage Salmon, and today I'm joined with
Amy Dang.
Mary Diaz.
And Clayton S.
And here's what we'll be covering today. We're going to start with general information, then we're going to talk about behavioral indicators, parent and guardian considerations, treatment goals and intervention focus, cultural considerations, and finally, community resources. I am going to start by sharing general information and importance of this issue. So, why do we need to address this issue of the queer experience in schools? Firstly, I'm going to talk about the historical treatment of queer people, so in the United States through legal action specifically, and also cultural attitudes. I'm going to talk about the current presidential administration and what they're doing that is harmful towards queer youth, specifically in schools. And lastly, statistics on queer mental health compared to their heterosexual and cisgender classmates. So to begin, I'll briefly talk about legal battles in the US regarding the experience of queer people. Specifically, the US has a really complicated history. There are both good and bad things that have gone on over time, but I found this really cool resource that I wanted to share because I don't simply have time to go over everything, is this really awesome timeline that shows you a bunch of different legal actions that have been taken or court rulings or bills that have gone into effect over time. So I think this begins in around 1920 and then it goes all the way up to present day. So this timeline really shows you, you can click through each and every one, what the US and how the US has treated queer people over time. So some important ones to mention are the don't ask, don't tell policy that was implemented in the US military, where you don't ask and you don't tell if you're part of the LGBTQ plus community. So there are ones that are harmful, but there are ones that are positive, like legalizing gay marriage under the Obama administration. So I'd highly recommend checking out this resource. I will share it in our resource guide. So this one is present day, what's going on under the Trump administration beginning in January 2025. So as you can see, I have six executive orders that Trump had put in at the beginning of his term, his second term. This is not all of them that affect the queer community. However, these are the ones that I felt were most relevant to the experience of queer youth in schools. So to begin, we'll start with initial rescissions of harmful executive orders and actions, which basically Trump took away a bunch of protections that the Biden administration had put in protecting diversity, equity, and inclusion in workplaces. So this extends into schools. Many of these protections protected queer people from discrimination based on their gender identity or sexual orientation. So there's less protection for them in that way. Another one is defending women from gender ideology extremism and restoring biological truth to the federal government, which essentially is federal funding cannot be used for community health centers that maybe do screenings for HIV, gender affirming care for trans youth, and generally cut funding to queer support systems nationwide. So I'll say a lot of these executive orders have state by state lawsuits that have been pending or that have gone through. But unfortunately, that doesn't erase the large scale nationwide culture shift that Trump is perpetuating by putting these executive orders in place. Another one is ending radical and wasteful government DEI programs and preferencing, which means that federally controlled agencies are not allowed to promote DEI programs or guidelines. Again, there are lawsuits pending, but it's still a nationwide attitude. We have protecting children from chemical and surgical mutilation, which essentially informed the best practices guide put forward by the Department of Human and Health Services, which says that trans youth should be treated with therapy only and they should not have access to gender affirming care in any other way, which is very unfortunate. Another one is ending radical indoctrination of K through 12 schooling, which ends teaching about diversity, equity, inclusion, and accessibility ideas in classes, specifically noting white privilege as one of the teachings they are not allowed to teach, and to implement a more patriotic education, which is extremely vague, and I'm not sure exactly what he means by that. And the last piece I wanted to talk about is the final rule changing ACA coverage of gender affirming care, which overturns the Biden administration's efforts to provide information to Medicaid recipients about gender affirming care. So really quickly, just to go over some stats about the experience of queer youth in schools. 32% of LGBTQ youth have been verbally harassed at school. 12% of youth have attempted suicide in 2024. 53% of these youth experienced symptoms of depression. 50% of LGBTQ plus youth who wanted medical health care reported it inaccessible. And 42% of the population above reported fear was the barrier to mental health care. So that's why you should care. And I'll be passing it off.
Now let's move on to behavioral indicators and student challenges. These challenges are affecting 85% of LGBTQ students from verbal harassment. LGBTQ students with multiple marginalized identities face more adversity and are isolated more often due to a lack of fostered community. LGBTQ youth have a doubled rate of suicidal ideation. Educators must watch for the warning signs of depression and social isolation. Symptoms of LGBTQ youth depression and key risk factors. At the beginning of this triangle, we have the declining interest in academics or passions, social withdrawal, self-harm and substance abuse, and lastly, suicidal thinking. This is high risk and immediate intervention is needed for the student. Some other factors that impact LGBTQ youth depression are being bullied or discriminated against by fellow students, a lack of family support, lack of support from educators, lack of access to mental health care, physical harm from others, being threatened with conversion therapy, and being misgendered or not being called by their chosen name. Now we move on to the complexities of assessment. Mental health clinicians must prioritize confidentiality and disclosure when engaging the LGBTQ student support system. They should consider the patient's safety, be aware of the acceptance or rejection by their family. Mental health clinicians should consider the student's relationship with their community and school, as well as possible supports when regarding disclosure of transgender, gender diverse, and/or LGBTQ plus identity.
Thanks, Sage. Next, we'll discuss parent and guardian considerations. Now, parental support can vary from household to household, and some families can be more or less supportive than others. But it's important to know that parental support and involvement plays a critical role in fostering a positive understanding of LGBTQ plus issues that children encounter. In fact, the CDC emphasizes that supportive, affirming parental environments significantly improve LGBTQ teens' emotional and physical well-being. Additionally, parental involvement with LGBTQ plus identity has shown to reduce depression, suicidal ideation, substance use, and risky sexual behavior among teens. So when you have the strong caregiver support buffering these kind of negative outcomes, you also will see a lower dropout risk and improved belonging, which is pretty great. If you look to the right here, you're going to see a little animation, kind of similar to what we had in the whole brainchild. I'm proud to say, and I want to shout out my partner, Riyad Mendoza, did this artwork for us and was proud to be a part of this advocacy. Here you see a teen boy saying, I think I like boys, but I'm afraid to tell people. And you see that his parents are taking a very supportive stance. Dad validating those feelings to be normal and happy that the son is confiding in them, and mom offering how they can additionally support them. Now, unfortunately, some families can be unsupportive, and there are several complex and interrelated reasons why some parents might not be supportive of LGBTQ youth issues in education and schools. These reasons often stem from cultural and religious beliefs, psychological misunderstanding, and sociopolitical factors. In fact, family rejection is also tied closely to homelessness. 40% of homeless youth identify as LGBTQ, which is pretty astounding. And if you look to the left here, you can see an animation of an unsupportive situation. Same teen saying that he likes boys and is afraid to tell people. This time, dad is a little dismissive, doesn't put down his paper, kind of waving his hand away, saying it's just a phase. Mom being more insecure about what others will think, or maybe what their religious leader will think. And although, this is just an animation depiction, these are situations that happen every day all around the world. So how do we bridge that gap? First, we start with awareness, empathy, and mindfulness. Awareness of each other and empathy for each other's different backgrounds and situations, not just, maybe for the teen who's going, through discovering their identity, but for the parents as well, because often they're just perpetuating what they learned from their parents or their upbringing. So it's important to have empathy on both sides and that both feelings are valid. And then mindfulness for each other and others. Now, school and family collaboration through inclusive events and clubs and meetings can be a huge impact in bridging this gap. Often having these school and family events interrelated with other events going on in the school, whether it's a sporting event or a social event like prom. These don't have to be necessarily LGBTQ plus events, but they can be integrated with the rest of the school, which can often get more people involved. And then there are certain clubs that are directed specifically for parents. The Trevor Project and PFLAG, to name a few, provide direct support and education for parents to struggling with their kid coming up with their identity different than what they expected, and basically providing education on how to journey through that in a positive way. And then last but certainly not the least is broader community collaboration. It's kind of a one, two, three punch. You got to have the support in the school, you have to have the support in the family, and overall, you have to have that support in the community. There are obviously pride events, but there's so many other, healthcare clinics and fundraisers and clothing drives and community block parties that raise awareness, provide HIV medication awareness or, facilities to people who might not have access to those. So really, it's about getting everyone involved to really maximize inclusivity for everyone.
Thanks, Clayton. Now we're going to talk about treatment goals and focus of interventions. So, LGBTQ youth, which I will refer to as queer youth in this presentation, experience more health disparities in comparison to their heterosexual and cisgender peers. This can present as mental health or physical health disparities. It's typically associated with minority stress, which are the unique stressors relating to one's stigmatized sexual orientation or gender identity. These can be external stressors, such as experienced discrimination and bullying, or they can be internal stressors, such as having internalized stigma or concealing one's identity. So, one of the biggest risk factors for poor mental and physical health outcomes for queer youth in schools is bullying. There are four main types of bullying that queer youth experience, such as verbal, social or relational, sexual harassment, or physical bullying. The most common type of bullying is social or relational bullying, which 86.2% of queer youth have reported experiencing. The least common type of bullying is physical bullying, which 31.2% of queer youth have reported experiencing as well. Overall, you can tell that a majority of queer youth have experienced bullying, making it a really important topic to address as mental health clinicians. Through the lens of the social ecological model, there are three levels of facilitators and barriers for school health professionals to address bullying. School health professionals include counselors, therapists, psychologists, and nurses. On the structural level, we have reporting and protocols, school buy-in, time and staff, resources, and culture of inclusivity. On the interpersonal level, we have trust and follow-through, confidentiality, and the fear of being outed, close relationships, and being a champion or an advocate. On the individual level, we have knowledge, skills, and attitudes of school health professionals. I've listed an example for each level, so please feel free to pause to read it. Unfortunately, there's a disconnect of how queer youth and school health professionals view the existence and the response to bullying in schools. When asked about the existence of bullying at their school, the majority of youth report that they've experienced bullying, while the majority of school health professionals report they haven't seen bullying. When asked about how teachers, staff, and other adults at their school respond to bullying, queer youth report that they don't identify or they have poor responses to bullying. On the other hand, school health professionals report that they have adequate responses to bullying if they see it. When asked what the main barrier to reporting or addressing bullying is, the queer youth report that interpersonal barriers such as being outed or not trusting adults to follow through is the biggest barrier. On the other hand, school health professionals report that the main barrier are structural barriers, such as not having enough time and staff, and that teachers and other school staff don't know the reporting protocols even though they've all received training for it. Lastly, when asked if their school's culture is inclusive of queer youth, the majority of youth reported no, while the majority of school health professionals reported yes. As you can see, one of the blaring issues when addressing queer bullying in schools are the differences between queer youth's experiences of bullying and how school health professionals and other school staff perceive bullying at their schools. With this in mind, the treatment goals encompass the individual, interpersonal, and structural levels. On the individual level, we need to validate queer youth's experiences, help them identify minority stressors as a challenge that they can overcome rather than a threat lingering in their lives, help them develop coping skills, and instill hope for their futures. On the interpersonal level, we need to be able to adequately identify and respond to at-risk queer students, use inclusive language, and develop close relationships and trust. Overall, we need to be an advocate for queer youth. On the structural level, we need to have ongoing trainings on the best practices on supporting queer youth, having more diverse, equitable, and inclusive practices to hire more representative queer staff, show queer students that they are a priority, and to provide psychoeducation to the school-wide community. This is especially important because we can't just target queer youth, but we need to target the broader community in order to cultivate a culture of inclusivity to prevent bullying and other poor mental health outcomes. I'm now going to pass it along to Sage.
Lastly, we will discuss cultural considerations, starting with intersectionality and impact. On this graph, you'll see students who hold both marginalized racial identities as well as LGBTQ identities and find that they experience compounded issues. These intersecting identities can cause students to skip school if they feel their environment is not safe or welcoming. 68% of Black LGBTQ students reported the highest depression levels when facing multiple forms of victimization, and 72% of Black LGBTQ students that did not report victimization felt the most school belonging. Most of these students that are holding both identities struggle with the highest school belonging, depression, and have the most missed school in the past month. Sexual orientation, gender identity, and Latinx ethnicity. LGBTQ students of color face further discrimination when identifying as transgender or gender nonconforming while having an LGBTQ+ sexual orientation. Transgender or gender nonconforming Latinx students face higher victimization across all three categories of victimization based on sexual orientation, victimization based on gender expression, and victimization based on race or ethnicity. Consider the cultural attitudes of a student's racial or ethnic background about LGBTQ+ identities. They may face further discrimination and victimization in their schools. Final considerations. Counselors and educators must consider the multiple identities that their students are living with while supporting these LGBTQ youth. Supportive school environments show LGBTQ youth that they matter and create preventative care for their mental health. Parental support varies but has an immense impact on LGBTQ student success and safety. Being aware of minority stress allows counselors and educators to have more clear understandings of what LGBTQ students experience. Schools should strive for a zero-tolerance policy and actively listen to student concerns. And lastly, promoting appropriate resources for LGBTQ youth of color that experience intersexual victimization allows them to connect with their community and build supports, halting the experience of isolation. Community resources. Here we have 4 community resources for you if you'd like to use them in your school sites. We have Rainbow Community Center, California Safe Schools Coalition, GLSEN, and PFLAG. Here are our references. Thank you.